Hi, I'm Dr. Ramya Narayanan, Strong Roots Dental. I have my colleague, Dr. Saloni Trivedi, here with me. Today, we're going to be talking about Invisalign and answer some of the most commonly asked questions about it. So, Invisalign simplistically means invisible braces. Okay, is it completely invisible? I don't think so. If someone is up close, they can definitely see it. But it's definitely better than metal braces. It is transparent. It is invisible for the most part. As I said, one has metal, one doesn't, for starters. And I think that's one of the main things. And the biggest difference for me is also your traditional braces is fixed, right? And your Invisalign is not. So one of the benefits of that is easy to keep the teeth and the gums clean, which is hugely important when moving teeth.
Right. One thing I may add is sometimes traditional braces can handle a few more complicated cases.
Absolutely.
Doesn't mean Invisalign can't, but when it's appropriate, we may tell you to go, refer you to the appropriate person to do traditional
That is
braces.
absolutely correct. Yes. For one, as I said, it's not fixed, right? So it's easy to keep the gums clean. And also traditional braces, as we spoke about earlier, can be used, or rather is used these days for more complex teeth movements. So when the complexity increases, obviously the comfort factor does go down a little bit, if I may say so. Right. So I think that's one of the main reasons. It depends. It can take anywhere between 6 months to a couple of years. It completely depends on the complexity of the case.
Right, and that's something we'll tell you when we see you
when you come in for your consult. Absolutely.
Right.
So the first thing would be to come in for a consult. So we would take a panoramic X-ray or an X-ray for us to decipher whether the gum and the bone around the teeth are normal, right? Is there any infected tooth? Because all of that has to be taken care of before we decide to move any teeth, right? And then we would take a scan or an Invisalign scan for us to see where the teeth are and what needs to be achieved, right? Once the patient and the doctor decides to go ahead with the route of Invisalign, it takes about a couple of weeks for us to get the trays from Invisalign. That's when we will need the patient's time for about an hour. That's when they come in to get the attachments or the tooth-colored buttons placed. So they act as anchors for the teeth to move. And then we go ahead and give them the Invisalign trays, which the patient has to wear for about 22 hours a day. So in other words, the only time they don't wear is when they eat, right? And then they come in to see the doctor about once a month. That is for us to make sure that the teeth are actually moving the way we want it to move, okay? Closer to the finish, we will go ahead and rescan again. Again, for the same reason, just to make sure the teeth have moved the way we want it to move. If there are any tweaks that can be done to better the outcome, obviously we will, right? And then at the end of it, you are given retainers. You get 4 sets of retainers. It's exactly the same. It's just in case you lose one, your dog eats one, you have another one, right? Okay. That's when your doctor tells you how to use those retainers, starting off with 22 hours a day and how to wean yourself out to wearing it only at night.
Right. And it's very important to wear them at night. So all the work that we did,
all the money and the effort that's put in should not go down to waste.
Exactly.
Compliance is key for Invisalign. So if you think you're not going to be able to wear it regularly, then please don't waste your time nor your doctor's time, right? But other than that, I don't think there is any absolute disqualification. One thing I would mention, it's very, very important to take care of your hygiene. Right? If the doctor feels that your gums are getting inflamed and you're running into periodontal diseases or things like that, then they will ask to stop. Invisalign.
Makes sense. And also we'll make sure before we start Invisalign that we're free of cavity problems.
Absolutely, yes. Like that. Yes. The patient has to be completely healthy in terms of, no decay, no infection, gum disease, all of that has to be taken care of before starting any kind of tooth movement. It can. Again, it depends on the severity of the crossbite. Is it blatant pain? I wouldn't say so, right? Is there going to be a little bit of pressure because the teeth are moving? Absolutely, yes. Again, I have seen some patients who don't feel anything. There are some patients who feel a little bit of discomfort. It does depend on the case. Some of them do. I think the best person to ask that question would be your insurance coordinator. In the state of New Jersey, the average cost for dental Invisalign would be anywhere between $5,000 to $7,000, depending on the severity of the case. Oh, that's easy. Just give us a call. Give us a call at Strong Roots Dental and hope we've answered most of your dental questions.